We've heard that story. Think back just a few months ago. We had a President Bush at war in the Middle East, out of touch with voters at home. There's a raging energy and healthcare crisis, and there's a Clinton running for president. Was it 2008 or 1992? The truth is, on health reform, it doesn't really matter because we haven't even crossed the starting line. And so after more than a decade of frustration on Capitol Hill, that's why I decided to run for the House of Delegates, because I understood that states heard the gunshot and started to run the race. We knew that if the feds wouldn't take care of it, we were going to try to do it at the state level. So in Massachusetts, in Vermont, in Connecticut, California, Illinois, Wisconsin, Maryland, we're seeing state by state legislators take the bull by the horns and saying, we will not settle for status quo. We're going to start making change happen at home and in our healthcare system. So even in tough budget times in Maryland last year, we dug deep into our pockets and got creative and figured out a way to expand health insurance to 100,000 more people in Maryland. That program is being implemented right now. And in state after state, these efforts are organized and pushed through by progressive leaders who rely on strong support and advocacy of women who get it. Women who understand that health care, as Donna said, is a moral imperative. Here in Maryland, we face enormous challenges providing health care to our children in particular. I was shocked to dig down into the numbers and find that we have 137,000 children in Maryland who are uninsured. We're the wealthiest state in this country, the wealthiest state in the nation. And rather than ranking first in getting our children health insurance, we rank 31st. 10% of our children are uninsured. That is shameful. What's even more shameful is that 90,000 of those kids qualify for coverage today and they're just not enrolled. It's not that we haven't been generous enough in providing this coverage. We just haven't been creative enough to figure out how to get them enrolled and keep them in those programs for which they're eligible for. And so we got innovative and proposed legislation, which I am proud to say is now law. It's the Kids First Act. We passed it first in Maryland, and Iowa just passed it, and New Jersey's working on it, and it's so fun to be the first in the country that does something everyone wants to copy. So take this idea back to home as well. Here's what we did. How do we find and get those 90,000 kids when we've already exhausted so many other creative ways to try to find them? Well, we're going to change the tax forms. Families in Maryland now, when they go to claim their child tax exemption, they have to report whether or not their children have health insurance. Very simple box. Check yes or no. Do your children have health insurance? Why is that critically important? The 90,000 is an estimate. We know that they're out there, but we don't know where they live. This is going to tell us where they are. And more importantly, what else do we collect on the tax forms? Information about how much your family earns. Your eligibility for these programs is related to how much money you make. So in Maryland, if you're at or below 300% of poverty and checking no, you have uninsured children that probably qualify for health insurance. So now what we're going to do is mail you the application. We're not going to wait for you to figure out that you qualify for this program. Many families erroneously think they don't qualify because they don't understand that working poor can still qualify for this program. So we're going to send them the application with instructions, say here's how you fill out this form, here's who you call if you have questions. You need to know that your children likely qualify. And because we've done this, we expect to get as many of those 90,000 children as we possibly can. So in the next couple of years, we will more than cut the number of uninsured in half and get us on the way to being #1 in the nation, no longer 31st. I share this story with you not only because it's a passion of mine, but also because it absolutely would not have been possible without a coalition of extremely talented, driven, committed women to get this done. We brought together coalitions of child health care, child welfare advocates, pharmaceutical companies even joined up, can you believe it? Once they saw that county governments and doctors and nurses and other health providers were all on board, everyone said, we got to do this. And all more than 50 advocacy organizations supported us in this before we called it a day and had a bill signing ceremony. But in the middle of it all, beating the pavement in Annapolis, working the phones, grabbing legislators on their walk from the floor back to their offices were many of the voices of the women involved in the Maryland Women's Coalition for Healthcare Reform. It's a group of incredibly talented, tenacious, strong-willed, and dedicated women in Maryland that just didn't want to take no for an answer on our drive to make sure that we cover all kids. It just would not have happened without them. My work as a delegate is quite simply the best job I've ever had. It really has been a joy to work and devise solutions to the problems rather than coming up with the problems to all the Republican solutions. That's what I was doing a lot of in Washington, D.C. I'm deeply proud of the work that we did at the federal level. It's refreshing to pass good ideas rather than working like hell to just kill terrible ones. And of course, with Congresswoman Edwards and her colleagues in the majority killing those awful ideas is going to be a lot easier at the federal level. But we have to step back at the state level and as advocates and understand that while we can march forward and make all that progress in Maryland and all those other states on health reform and a whole host of other issues, there is a limit to what we can do. We can only do so much. We have to work at the federal level if we want positive change for everyone in every state. We can't just rest that, okay, in Maryland we're going to get all of our kids covered. We want everyone in the country covered, right? And so to do that, we have to keep working as a collective group to continue to grow our numbers, as Congresswoman Edwards said, to have good people in the Congress helping us achieve this at the federal level. And it's going to take winning the White House, obviously, as well. It's going to come to no surprise that to women in this room that the Bush administration has really required us to look over our shoulder time and time again. Rather than marching forward on health initiatives, we've had to work to make sure that we didn't backstep on the gains that we had during the Clinton administration. By stacking the deck against the states, the Bush administration really has worked to erase those gains, and we've had to fight hard to make sure that we hold on to it. Just recently, when Bush was trying to cut Medicare payments for doctors by 10%, it took Senator Kennedy storming back in the Senate after his brain surgery to stop it, and then we had to do a presidential override of his veto to make it happen. We work hard. We're going to have Barack Obama in the White House and an even stronger Democratic majority, a feminist majority someday, to really make that difference that we need at the national level too. And to quote Senator Clinton, let's remember that the stakes are simply way too high to gamble on a McCain victory this fall. Nowhere, in my opinion, is this danger more evident than in his health reform policies. It's not that he wouldn't reform health care, it's just that his reforms are nothing but the latest in the string of insurance company handouts carefully designed by right-wing think tanks that he works with. They do little, if anything, to expand coverage to more people, little, if anything, to lower costs for everyone else. It's really kind of a scam proposal where he would send Americans out into the individual insurance market and say, go fend for yourselves and get some health insurance. There, the insurance companies would be able to deny anyone who has a pre-existing condition from getting on. Now, how many of us are going to eventually end up with a pre-existing condition, right? So if elected, McCain's going to ask the states to help out by allowing the sickest people to join into these high-risk pools. But we'll not just have the sickest people, we'll have people with just even who have appendectomies and diabetes in this pool. And so the insurance companies will get richer by only insuring the healthiest people, and the states will go bankrupt because we've got all the sickest folks, and the whole social compact of health insurance will completely unravel. I have to scare you a little bit in order to get you wound up to go out and beat the pavement, to make sure that it's not, this isn't just, we got to get into the issues sometimes. So often the journalists want us to only think about politics and the election in terms of personalities and platitudes, but there are real fundamental issues on how our country is going to work based on who gets elected in the White House and what decisions get made on our behalf. And it's our voices, the collective voices of running out and talking to all of our neighbors and making sure that they understand what it is truly on the ballot this season. Is not just whose personality do you like better or what held over grudges might we have from the way the primary played out. There is serious, serious work to be done in this nation, and we have to get behind the Democratic nominee in order to get it accomplished. I want to thank you for what I know is going to be an amazing election season at every single level. Go out there and use your voice to make a difference on the issues that is our common purpose here in this room. I want to thank you for inspiring all of us to be in elected office, and I want to ask you to consider running for office yourselves. Thank you so much.